am Kristen at UT Southwestern Medical Center. Thank you for joining us for our chat on exercise and depression. As you may know, May is National Mental Health Awareness Month, so we wanted to sit down with Chad Rethorst in psychiatry to discuss some of the trends in there. Dr. Rethorst is an associate professor of psychiatry, and he's affiliated with our Center for Depression Research and Clinical Care, and his research focuses on fitness and depression. So it should be an exciting time. As usual, don't forget to like and share this conversation so that others can see it, and leave your questions in the comments section of the live feed. We will take as many as we can get to. I know we already have several coming in, and we're going to address those first. But I wanted to start out, welcoming you to the chat and participating. Thank you.
Thanks. I'm happy to be here.
Absolutely. So the first question is, how did you become interested in studying links between exercise and depression?
So I grew up playing sports, was always really active growing up, got into college, and knew I wanted to do something in the field of sport and exercise, but wasn't really sure what I wanted to do. Through taking a variety of courses, really fell in love with my psychology courses, and then it was kind of trying to find a way to marry my two interests, and that's kind of how I got to here.
And here we are.
Yeah.
So we had a question that came in earlier from Peggy, and I hope she's watching now. She says, if you're diagnosed with MDD and also an introvert, does group exercise typically be more detrimental to somebody's mental health than exercising alone, or is it a good thing?
So the first thing we always tell patients is the best type of exercise is the exercise you will do. So if you're not comfortable in a group setting, then it's fine to be exercising by yourself. There are obviously some additional social benefits to being out and interacting with other people, and especially in the context of depression, that can be important. But I think it's more important that you find the activity that you're comfortable with, and it's something that you will do for a long time. So if that's exercising by yourself, that's perfectly fine.
Okay. So what are some of the benefits of exercising in a group, per se?
So you get a little additional social support. You hear a lot about people finding workout buddies. It's a good way to keep yourself accountable, and you can hold the other person accountable. And then in the terms of depression, obviously, there are just additional benefits to social interactions that can be beneficial as well.
Gotcha. And I will admit that I like exercising by myself the one time of day I have to myself, but it sounds like social is good as well. So we've got other questions coming in. This one is from Mary, and this is a really interesting question. So does it matter the type of exercise, or is it whatever you'll do?
Yeah, I think it really is whatever you'll do. There have been researchers who have looked at aerobic type exercising, walking, running, riding a bike. Researchers who have looked at resistance training, weightlifting. Even studies of yoga now have started to come out, and all of them seem to have about the same level of benefit. So again, it's really finding that thing that you will do.
So it doesn't have to be aerobic exercise. You don't, where you often get kind of that runner's high?
No, not at all. And I think even low intensity aerobic exercise. So for a lot of patients, the easiest and the most accessible form of exercise is just going out for a walk, and just finding the time in your day to do that.
Good to know. So here's a question from Jessica. She asks, if exercise helps clinical depression, why don't doctors prescribe it?
So I think there are a lot of reasons why doctors don't prescribe it. Now, there are some doctors who do prescribe it and do a very good job of it. But there are a lot of barriers for other providers to start the process. So I think first of all is often in their trainings, they're not trained in how to prescribe exercise. So there's probably a knowledge gap there where they're not comfortable with the prescription of exercise. There are barriers in terms of what is an effective exercise prescription that I think a lot of us have probably been in our doctor's office and we have that 30-second conversation about, you should really go out and exercise more. But while that's a nice conversation to have, and it's better than not having that conversation, it's probably not enough to really have a big impact on the patient's behavior. And
seems to be missing that take action. This is what you can do.
Right,
part of it.
Absolutely. And then there's the problem of what happens to the patient once they leave the doctor's office. That especially in our healthcare system, there isn't a nice link between the medical setting and then a gym or a recreation center. So making that connection between the two is another barrier.
Okay.
And I think specifically in depression, there are still a lot of providers that aren't convinced that their patients will exercise because they're depressed. But what we know is that most patients with depression express an interest in being more active. And in the research we've done, they actually do the exercise. They're as adherent to exercise as they would be to psychotherapy or medication.
Okay, well, we have a related question from Mary Thibault. She asks, how long should you exercise to see benefits with depression? Is there a time limit?
Right. So I think the hope is that you'll feel at least a little bit of an immediate benefit.
Okay.
So that's something we really try to emphasize for our participants in our studies or patients, is that to really pay attention to how you feel immediately after the exercise session. Most people will report feeling more relaxed, maybe feeling a bit more happy than they were when they started. So I think that's a good place to start. I think long term, in terms of how long it takes before your depressive symptoms start to alleviate, that would probably take a couple weeks, say 2 to 4 weeks, before they would really experience a significant decrease in their symptoms.
Okay. And Susanna had a similar question. She asked, does the time you exercise make a difference? What I think she's asking is, does the amount of time you exercise make a difference?
So I think more is better up to a point. Most of the evidence that we've seen kind of falls in line with the public health guidelines for 150 minutes of exercise per week. But there's sort of a nice relationship between the amount of exercise you do and the benefit you get. So, some of the most benefit we can get for a patient is getting them from 0 minutes of physical activity to at least some. So there's a benefit even if you aren't getting all the way up to 150 minutes. And I think that feels more feasible for patients too, not starting off with that big goal of 150 minutes. But
it sounds like a lot if you're not doing much.
Absolutely.
So related to something we discussed earlier, a question from Zach, and I know you're doing research in this area. His question is, what is the obstacle to providers handing patients a written prescription for daily activity? Is it as simple as creating a form? Is it not, there's not a space on maybe a prescription pad for that?
Right. So yeah, there is evidence that providing a written prescription can be effective in getting patients to be more active. So it's definitely a useful strategy. Again, it may be a knowledge gap issue where maybe some providers aren't aware of that evidence and haven't implemented into their practice. There are obviously the time constraints of especially primary care visits where you don't get a lot of time with the patient, so trying to address everything can be a challenge. But yeah, it can be a useful strategy. There's great examples actually online. The American College of Sports Medicine, they have an initiative called Exercises Medicine, and on that they have a whole bunch of resources for patients, for providers, and they actually include an example of a prescription pad that providers could use to give to their patients.
That sounds great. So since you mentioned it, we have a question from Cece. What about kids and teens? Can exercise help their mood as well, or are we specifically looking at adults?
No, for kids and teens, there are also benefits, both in reducing depressive symptoms for those kids and adolescents who have depressive symptoms, but also now there's a lot of good evidence that exercise can prevent the onset of depression in the future. So finding ways to prevent depression, exercise can be helpful there too.
So then is it the same for teens? Like, is a student athlete, are you saying they're less likely to experience depression at some point, or is that uncertain?
Yeah, so the evidence would suggest that if you're more active as a teen, that you're less likely to be depressed either as a teen or even on to adulthood.
All right, thank you. So we've got a great question here from Jenny King. And does the intensity of exercise matter? What about in senior citizens who have limited strength and mobility? Will any extra movement or exercise make a positive difference for them?
Right, yeah. So I think any intensity is fine for most people. I think it's a matter of doing more than what you're currently doing.
Okay.
So, for a lot of people, again, it may just be walking. In the older adults, we see some evidence for walking and aerobic exercise. There's also evidence, especially in older adults, for resistance training.
Right.
Because I think that has the additional benefit of addressing some of those mobility issues that come along with older age.
I know personally I have older relatives who try to get in the gym and do some resistance training at least a couple times a week to help them stand up tall and get around easier. So that makes sense. So here's a different question from Lori, and she asks, what is the difference between true clinical depression and just feeling a little blue?
So typically it has to do with the duration of how long you're feeling that way. So it's severity and duration that when someone is diagnosed with major depression, that it's symptoms that have been occurring for at least 2 weeks at a certain severity level.
Okay. So I know this is something that you've been studying for a while. Have you learned anything new in the past couple of years that surprises you about the link between exercise and depression?
I don't know if surprise is the right word, but one of the things that we're really interested in is for which patients is exercise the best option. So we know in treating depression in general that different patients respond to different treatments. So medications work really well for some patients. They don't work at all for other patients.
Right.
What we've done with exercise so far, the same seems to be true, that for some people it does really well, and for others they don't see the benefits. So we've done a lot of work in trying to figure out who are those patients. So instead of doing a trial and error process where we try one treatment and it doesn't work and then we try another, if we can predict ahead of time which treatment will be best for them, then we can.
That would be spectacular, because I was just about to ask you, how do you tell who exercise will benefit and who it won't?
Right. So I think clinically, for someone who is working with a patient, the first step would be if they are interested and willing to exercise. So I think that's the first step, because the strongest predictors that we have seen in our research is adherence to the exercise program. So if they do it, it's more likely to work. We've also looked at some biological markers and some clinical characteristics. We're still developing those to figure out the best way to kind of identify those patients for whom exercise is the best. Okay,
that'll be interesting to find out someday. So related to that, a follow-up question from Mary. Has your research indicated whether treatment-resistant depression whether that is helped with exercise?
Right. So we have done one study here several years ago, the TREAD study, where we enrolled patients who had been on an antidepressant medication but had not fully achieved remission with that medication. So they still had depressive symptoms despite being treated. We enrolled them in an exercise program and did see a positive benefit for them. So even for those patients for whom medication hasn't worked, they can still get a benefit from exercise.
Okay, really great question, Mary. Another one from Cece, and I believe you touched on this a little bit. Are there any known genetic links to depression? You mentioned a couple of little factors.
Right. Yeah. So there are definitely some genetic markers that seem to be associated with depression. We see a lot of what we call gene-environment interactions. So a gene or a set of genes alone is not enough for someone to become depressed. But what usually happens is we think of it in terms of the genes make someone vulnerable for depression, and then they experience something in their life or in their environment that sort of triggers that depressive episode.
Okay. So it's not something that you can necessarily screen for, and
right. Yeah, and that's one of the challenges when we start looking at prevention of depression. Is it's really hard to predict who's going to become depressed later on, so it's hard to target those interventions.
Okay, here's a different question. This is what I wanted to ask you. What are you studying now?
Okay, so I'm interested in a couple of things, but one of the things that I've done a lot of work on now is, now that we know and have a lot of evidence that exercise is beneficial for depression, how do we move that into clinical practice? So we're working with some primary care clinics to implement exactly as we talked about earlier, sort of that prescription for exercise. That prescription of exercise is coupled with patients getting referred to us. We meet with them once a week for 12 weeks. To see how that crossover and really, trying to create that link between the medical setting and then a setting where the patient can go and be active.
Okay, good to know. So how can, given that, I know we talked earlier and you mentioned that you're not actively recruiting for any clinical trials at this point, but for the people that are watching, I know they come from various facets of life. How can they be involved, or how can they support this research? Is there a registry that they can add their name to?
So yeah, we have a phone number and a website. The CDRC website is a great place. There's a place there where they can go and find out more information on the trials that we do have going on. And then also, if they have specific questions, contact someone here and they can give more information about the different trials that we have going on at any given time.
Perfect. So we'll share that information. We'll share a link to the center website as well as a link to the Facebook page in the comments. So definitely take Dr. Rathorst up on that. We've got more questions coming in. These are great questions. You know, we're a little more than halfway through, so if you have one, please get it in now because we're going to run out of time really quickly. Here's a question from Lori. What about wearing a Fitbit or other device? Is that helpful?
It can be helpful.
And why is that helpful? Or why could it be?
Right. So the idea is that it allows you to self-monitor your activity. You have a better sense of what you're actually doing on any given day. I'm wearing one right now.
I noticed that.
And so if you're setting goals on a regular basis and using the device to monitor your progress towards that goal, it can be pretty helpful. There have been a few studies that have come out, though, that have shown that it's not particularly useful, that for whatever reason there isn't an added benefit. So I think it's individual. If it works for you, go ahead and try it out. But it's certainly not a cure-all. It's not the one thing that will make you more active.
Definitely not a cure-all. I'm curious, though, from your perspective, if you have a Fitbit, if somebody is depressed and they're using it to track their activity, do they run the risk of maybe becoming obsessive about it? Has that been looked at or studied?
I don't know if anybody's looked specifically at sort of becoming unhealthily obsessed with it. Right? Yeah. I think the danger, or one of the potential downfalls is, while it's great if you're tracking your progress and you're meeting your goals, it's also a very clear indication of when you're not reaching your goals. So in that way, it can sort of be a double-edged sword, I would think.
Okay. Thank you for answering that. So we've got another question in here. As a whole, do you think our healthcare system is moving toward a more integrated model that views physical and mental health as interlinked?
Yeah, I think definitely that there is progress in that direction. I think there are obviously other things that continue to need to be done, but I think compared to where our healthcare system was 10 or more years ago, I think there's been a big move towards integrating the physical and mental health together.
So I know you're primarily involved in the research side. You don't see patients, but are you familiar with, and this is a question that came in, how treatments for depression have evolved over the years?
Yeah, so I mean, a lot of the work that a lot of my colleagues do at the Center for Depression is revolved around creating new treatments. So, it's new psychotherapies or new ways to deliver psychotherapies, new medications that continue to be tested. So yeah, we're always interested in finding new and novel ways to treat depression.
Interesting. So we have another interesting question from Jenny, and I'm not sure if you've done this before. That's what she asked. She asked if you've worked with the HR industry at all to see how exercise during the workday can help with employee positivity and productivity.
No, I have not done that work. I'm aware of other people who have.
Yeah.
It's sort of a booming industry, I think, in terms of the employee wellness programs.
Right.
And I think the nice thing about those programs is it's a place where you can reach everybody. That anybody who is working, could potentially have access to one of these programs. And there have definitely been studies that have shown the benefit in both employee health, but then also the productivity aspects as well.
Well, we definitely, I'm sure you've seen people, walking the concourses around here or walking on our campus walking trails. There does seem to be a little bit of a push for people to get out and get more active. And it sounds like from your perspective, that's a boon all the way around.
Yeah, absolutely. Both for the employee and the employer, there seem to be benefits.
Okay, so we are running out of time, everybody. We have probably about 5 more minutes for your questions. So now make sure you send them in. These have been great ones so far. I'm curious, what is next on the horizon in terms of research related to exercise and depression?
So I think it's continuing to figure out the best way to get people to exercise. One of the things that I'm really interested in is sort of developing the most effective interventions possible. So whether it's using a wearable device, and I think there's a lot of promise in using that device as part of an intervention to really target people when they're most likely to be active and providing them the right type of support at the right time to help them in their activity goals.
Okay, so I want to go back to a question that we had earlier, because I know we have some new people that have joined. I'm seeing the numbers uptick. They wanted to find out, how much exercise do you need for it to be beneficial?
I think what we say is some is better than none and more is better than some. So I think, for someone who is not active at all, it might be a 10-minute walk a couple of times a week.
That's something.
Yeah, and then the idea is that over time you can kind of build up. I think the ultimate goal is that 150 minutes a week, but there's benefits for smaller amounts. So finding something that you feel is feasible and realistic is the place to start.
Okay, good to know. So here's the other question from Mary that came in right after I asked you that question. Is exercise just beneficial for depression, or can it help, bipolar, schizophrenia, other mental health?
Yeah, there seems to be some evidence in the other mental health disorders. Most of the research has been done in depression. There has also been a lot done in anxiety disorders that shows a benefit of exercise. And just in the past couple of years, people are starting to look at exercise for schizophrenia and bipolar. The evidence is promising at this point, but not at the same level as what there is for depression and anxiety.
Okay, so we're moving that direction. So we do have a question here from Susanna. She asks, this is interesting. Is there an added benefit for exercising outdoors versus indoors?
Yeah, that's a really interesting question. It's a new field of research, and there does seem to be a little bit of additional benefit for being outside.
Gotcha.
So
it's the sunlight and the fresh air?
Sunlight, just being in nature, there seems to be a benefit too. So even separate from being physically active, just being outside, there seems to be a benefit.
Fascinating question, Susanna. Thanks for asking. So here's a different one from Elizabeth. And this is a challenge. She says, it seems that it would be difficult for depressed people to become motivated to exercise. How do you overcome this obstacle? Are there ways that, that you encourage research participants maybe to try something?
Right. So, as we've talked about, first of all, we try to start small, setting really small, realistic goals. When we're working with our participants in our studies, we sit down with them at the beginning of every week, and we plan out their week so they know specifically on what day and at what time they're going to go out and be active.
Gotcha.
And
so you actually put it in their calendars.
Yeah, absolutely. Yeah.
Okay. That sounds fantastic. I think though there's a lot to that once you have it on your calendar, then it's there. You're like, okay, I have to go do this now. It becomes kind of a checklist. Is that the thought?
Yeah, that's the thought. And the other thing we do in conjunction with that is we talk to them about what are the potential barriers. So what are the things that might get in your way? And if they, typically they can identify one or two barriers, and then we'll spend a few minutes sort of proactively thinking about, okay, if that happens, what's your plan to overcome that barrier? So instead of having to react to that barrier in the moment, they've already developed a plan for it.
Gotcha. So they know when they wake up, oh, it's pouring rain outside.
Yeah.
What am I going to, it is today?
Exactly.
What am I going to do today? All right. Well, I think we have the last question here from Mary. Oh, and this is it. She says, I like making a to-do list and being able to cross off exercise once I do it. So you're well on the way.
Very good.
That's really great. So we are all out of time. I want to ask you one final question. Kind of, what do you, from the research that you've done and your experiences, what do you think is the most important message for people regarding this topic?
I think it's the matter of going out and doing something that it doesn't have to be a big audacious goal. It just has to be a 5 to 10 minute walk every day or every other day.
So you don't have to run a marathon.
You do not.
Or enter a triathlon. No. You can just go out and walk around the block.
Absolutely. Yeah.
Okay. All right. Well, there you have it. So I want to thank you for joining and participating in our chat.
Yeah, thank you.
I want to thank all of our visitors. As you know, for all of our chats, this will be live and available on our Facebook page later today, and we will also post it on our UTSW Med YouTube channel. We will share that link in the comments. But in the meantime, I want to thank everybody for tuning in, for all the great questions, and hopefully we'll see many of you next week when we talk about stroke treatments and prevention. So have a wonderful day.